Welcome to the third installment of our Public Health Thought Leadership Series. Launched in July 2013, the Public Health Thought Leadership Series was aimed at sparking critical conversations and gaining insights in today's public health issues. Established by the school, the series features presentations and discussions with leading experts in the field.
And now, we would like to invite the session moderator, Professor John Wong, the Chief Executive of NUHS, to kick-start the session. Professor Wong.
Okay, welcome to our Thought Leadership lecture. This is a series that the School of Public Health has been running since 2013. And I think, as you have heard Dr. Chan herself introducing herself in the earlier session, I don't think we need to tell you too much more about her, except to say that she's been a true friend of Singapore and NUS, besides being one of our most distinguished alumnus, and therefore, for all 700 people who are watching this, you can all aspire to be the Director General of WHO. But, Dr. Chan has really graced us. She was here for our 100th anniversary of the medical school at NUS in 2005, and now on our 110th anniversary, she's back again. And so, Dr. Chan, welcome home. I think we're facing a really unprecedented time in history, but it's very important to always go back and realize that Singapore, we've always said we have no resource except our people. And we need to move away from glib statements and really ask ourselves what that means. And that, to me, that means if people are our only resource, we should do everything possible to ensure that they're safe, they're healthy, and they're able to achieve their maximum potential. So the two twin pillars of education and health become so critical, because without those, it's impossible to build Singapore to what it is today. It's impossible to build Asia to its full potential, and it won't be able for us to live in the global community that we do. So I think it's most appropriate this time that we have Dr. Chan share her thoughts with us. What we're going to do for the next half an hour is hear Dr. Chan's, and I'm hoping she will do a free-ranging talk rather than any prepared script. And then after that, we're going to have about 45 minutes or so of Q&A, and so I think this will be a really exciting session. Dr. Chan, please.
Thank you very much, Professor John Wong. Friends, colleagues, distinguished young champions in public health, welcome. So, ladies and gentlemen, I will, as requested, to provide an overview of where public health community stands as the world transitions to the post-2015 development agenda. Let me give you by way of background. What do we mean by post-2015 development agenda? As you are well aware, as we are speaking, countries of the world, more than 195 of them, your Ministry of Foreign Affairs in New York are negotiating what will be the Sustainable Development Goals from 2015 to 2030 for the next 15 years. So there are on the table 17 goals. So it will take about a year for countries to come to final agreement, hopefully before September this year. That's the next big occasion where heads of governments and heads of states will be meeting in New York to endorse those goals. So it's not a given yet. There are 17 of them, and health is one of those 17 goals. And you may be disappointed. You say that, oh, in MDGs, we have 3 health goals. How come now we have only 1? Does that mean health is not important? Yes and no. The background to this is, in the Rio +20 meeting, countries of the world in Brazil discuss and debate what are the important goals for post-2015. And I don't mind to tell you, the first draft for negotiation, health was so anemic, and we can describe it as living in a bed in ICU on a lot of respirators. And thanks to the hard work of civil society, medical students, and countries, eventually now, health is one of the 17 goals that I referred to. But one health goal, we incorporate all the unfinished agenda of MDGs 4, 5, and 6, HIV, TB, malaria, maternal and child health. They will continue to occupy center stage in health. But more importantly, what was left out in year 2000 when the MDGs was formulated was non-communicable diseases. On this occasion, it will be included. As we have heard again and again, the importance of NCD. And I also am happy to know that at least majority of the countries realize the importance of universal health coverage and care. And so Singapore, and you need to urge your Minister of Foreign Affairs to continue to argue, negotiate, and make sure universal health coverage is present. And I want to also recognize other countries like France and Japan, who are the leaders in this area to push for that. So we keep our fingers crossed and make sure that health will be included in the post-2015 development agenda. Now, the language that have been used when countries negotiate for post-2015 development agenda is nobody should be left behind. And one of the important goals is poverty elimination. And then another sort of common rhetoric is about inclusive growth. What do all these mean? What do all these mean? And we also know from reports from the World Bank, from WHO, from the Lancet Commission, the big body of evidence to link good health to wealth. And Prof, you just mentioned about the importance of people. Educated, healthy human capital is important for the country, for any country's development. So that brings me to give you an overview of what have been achieved in MDGs, and then going forward, what are the implications of the changes in the country's reality will affect the way post-2015 development agenda will be played out and then will be implemented. I can say, that public health stand on considerable success in bringing down some long-established, sometimes ancient, health burdens, but we also face new challenges. And these challenges are historically unprecedented in terms of its complexity. The MDGs, 8 of them, have been good for public health. The yearly number, let me give you a few statistics, of childhood deaths stuck at more than 10 million for decades, dropped to 6.3 million, and is now continuously to fall. Each day, 17,000 fewer children die than it was in 1990. The AIDS epidemic, it reached a tipping point last year, with the decline of new cases and deaths now steady. At the end of 2013, close to 13 million people worldwide have received antiretroviral therapy, nearly 12 million of them in low and middle income countries. This achievement ranks as the fastest scale-up of a life-saving intervention in history. Last year's report on world malaria situation was again very encouraging. Some countries in sub-Saharan Africa have recorded reduction of more than 50% in malaria mortality and morbidity. Many malaria wards, some of them I visited, were actually empty. And that's the good news. And the funerals of small children are no longer a feature of daily life. Several endemic countries, also in sub-Saharan Africa, are planning for strategies to eliminate the disease. Building on past success, ambitions Also for tuberculosis, likewise, rose, with WHO targeting more than 30 countries for elimination of this disease. That goal was supported by improvements in diagnosing TB multi-drug resistant forms. Here, this is also an advantage for Singapore, your R&D in innovation. Later this month, the World Health Organization will launch a report on global status of the neglected tropical diseases. This group of diseases, 17 of them, they blind, maim, disfigure, and disable more than 1 billion people in the world. And these are the poorest of the poor, the bottom 1 billion people. And these people are anchored in poverty by this group of diseases. Just a few statistics from that report give you an idea of the results that have been achieved in the last 10, 15 years. Verification that lymphatic filariasis has been eliminated has begun in 6 countries. Sustained efforts by a network of African countries have reduced the incidence of African sleeping sickness by 90%. Industry has donated enough medicine to WHO, and through WHO to many countries in the world to blanket all endemic countries in Africa and beyond with preventive treatment for schistosomiasis. Since 2006, more than 5 billion anti-parasitic treatments have been delivered through WHO to some of the poorest people on earth. This initiative is paving the way for what we call an exodus from poverty. If indeed poverty elimination is one of our objectives, one of our goals for post-2015, this is excellent achievement, but we should not be complacent. We need to continue to build on these achievements and make further progress. This group of diseases may sound very unfamiliar to you, but your pioneer generation would understand. For those of you who are 65 and above, I qualify for that, would appreciate, when Singapore was established 50 years ago, the situation was very different. So for those of us who had the privilege to live through that stage would appreciate the progress you have made. Going back to the visionary leadership of prime ministers, successions of prime ministers in this country, investing in education and health of its people and the environment. You are one of the first countries in the world to have a dedicated ministry to deal with the environment. Congratulations, because we are seeing many of the problems that are coming from the mismanagement of the environment. So, friends, colleagues, experiences since the start of this century tells us extremely clear that investment in health development works. And these successes in getting the disease burden down are especially important as the world transitions to the post-2015 development agenda. Bringing these well-known diseases under control frees hospital beds, staff, and resources for responding to much more complex, demanding, and costly challenges that lie ahead. Let me illustrate this 21st century complexity by looking at 3 events from the previous century. In 1945, Alexander Fleming and 2 other physicians were awarded the Nobel Prize in Medicine for their discovery and development of penicillin, the world's first antibiotics. In his acceptance speech, Fleming asked clinicians to administer penicillin with the utmost care, as both overuse and underuse would hasten the inevitable development of resistance. The era of modern medicine was thus ushered in with a prediction that it could also end very abruptly through irresponsible use of fragile medicines. A photograph taken in New York City in 1947 shows long lines snaking along the city's sidewalks and streets. with thousands and thousands of people patiently waiting to be vaccinated against smallpox. The stimulus was a single imported case in a business traveler with onward transmission to 2 other New Yorkers. Millions of city residents were vaccinated within a few weeks. Those were the days when people had full confidence in science, trusted the advice of health officials, and did as they were told. In 1954, the first frozen TV dinners entered the market and quickly changed the way millions of households spent their evenings. For those of you who have enjoyed TV dinner in front of a TV, you know the experience. That convenient intervention illustrated the ability of industry to capture emerging social trends, cater to them with innovative products, and reinforce those trends through aggressive marketing, thus perpetuating the demand. A generation of sedentary couch potato, you know the term couch potato, right? Shaped by sinking prices of TV sets and the appeal of convenience foods was born. The discovery of miracle drugs, public faith in the certainty of science, and the use of new technologies to improve the food supply were all good things that went bad. Fleming's warning fell on deaf ears. Widespread misuse and overuse of antimicrobials sparked the development of resistance to more and more medicines for a growing range of pathogens. With few replacement products in the pipeline, the world is moving towards a post-antibiotic era in which common infections will once again kill. The public lost its faith in science. People no longer lined up obediently to follow public health advice. They formed their own opinions using their own resources. You know, go on the social media. People will research everything before they go and see a doctor and tell you, doctor, this is what I want. And that should not come as a surprise with educated population. As I said, the rise of social media means that personal views also on scientific issues get taken as fact and widely propagated, while traditional safeguards like peer review and precise scientific and statistical methodologies fly out of the window. Anecdotes have more clout than evidence. The public needs to understand that science is not a democracy in which the most popular websites, the most articulate bloggers, or the loudest politicians get to decide what is best for health. The measles outbreak, currently sweeping through several US states and in Europe as well, should never have happened. Misinformation and unfounded fears allow a disease that belongs in the history books to come back. Counterfeiting of medicine is one of the problems. And also, as I said, the misuse, overuse and underuse of antibiotics is also giving us big trouble. Now, in order to overcome these fears and facts, we have to make full use of public health. We should not allow these to blunt the power of public health. And how do we do that? Yes, with the kind of robustness that we were talking about in our earlier session, how can we translate science and evidence into societal solutions that can help to change human behaviors? Human behaviors is our biggest challenge going forward. Advances in food technology make the food supply more secure, and that's good, and also change its nature, as I said. The industrialization of food production paved the way for a corporate approach to the food supply that concentrated almost exclusively on increasing quantities and reducing the cost of food. Again, the R&D investment for food industry beverages are much bigger than your R&D budget. What do they want to find out? Number one, consumer behavior, consumer preference. They give you what you want. And in exchange, they want you to open your pocket. The primary purpose of the food system, that is, to provide the nutrients that sustain human life in good health, got lost along the way. Highly processed foods, rich in fats, sugars, and salt, but low in the essential nutrients, took over. So, friends and colleagues, in our closely interdependent world, health everywhere is being shaped by the same powerful forces like population aging, rapid urbanization, and the globalized marketing of unhealthy products. Under the pressure of these forces, chronic non-communicable diseases like heart disease, stroke, cancer, diabetes, and chronic respiratory diseases have overtaken infectious diseases as the leading cause of mortality worldwide. This shift has profound implications. Medical research is one of the few areas of innovation where new technologies keep getting more costly and more sophisticated to use. Unlike your flat-screen TV or your mobile phone, new generations is much more user-friendly and cheaper, right? This is not the case in medical innovation. The cost of chronic care for diseases like cancer and diabetes are not sustainable and not affordable. And of course, experts often say that prevention must be the cornerstone of the global response to NCD, but prevention depends a lot on human behavior. Changes in human behavior and also changes in corporate behavior, the way they market unhealthy products. Now, tobacco is famous for their devious behavior, unscrupulous marketing. Unfortunately, some other industries are following suit and using exactly the same marketing tactic to target young people. So be smart, don't drink too much. And of course, you know, the other unhealthy food. And also, you know, Prof. Chia Kising also mentioned, the collaboration in public health is very different in order to tackle the root causes of NCDs, because the root causes are beyond the health sector, where the Ministry of Health has no control whatsoever. Because, you know, these are linked to trade and to many other issues, which the Minister of Health has no role in policy setting. So in other words, the upstream policy formulation in other ministry has huge impact on health. Health is always at the receiving end of failures of prevention in other ministries. Of course, they don't like to hear this from me, but that is the reality. Just look at, you know, promoting healthy lifestyle in this country. They think about transport. They think about the environment. They think about the healthy food that you should be getting from hawker center, and so on. These are all linked. So without working with other sectors, you would not be successful, working single-handedly and alone on your own. And that's why I say every minister in a government is a health minister. They must wear the health lens in formulating their public policies. And the coherence between public policy is also important. Let me give you one more example. Tobacco control. The Framework Convention on Tobacco Control in WHO is perhaps the single most sort of endorsed international treaty by countries of the world. And I have a few countries who are now taking Australia, who bravely introduced the plain packaging, which is very good for tobacco control. A few countries take them to WTO for trade dispute. The Minister of Health signed up to the Framework Convention on Tobacco Control, and yet the Minister of Trade of the same government take Australia to WTO for trade dispute. I can never understand that. Can you? Maybe your young minds can. And we must understand also reality. We talk about the reality on the ground. Oftentimes, it is not level playing field. Market power readily translates into political power. Very few governments prioritize health over big businesses. And this is our challenge. Don't feel disappointed if your advice to your government was not taken on board, because politics will always trump you. Science is important, evidence is important, but don't rely on the Minister of Health to be able to defend everything in front of your PM, but your PM is a good one. I talked to him about the importance, some of the initiatives that he introduced in terms of the universal health care and the pioneer generation, the benefits. It's amazing. In his address to the ministerial conference on universal health care, I was saying to Minister Gan, I said, you have a tough job because your Prime Minister knows the health system so well. And this is always a challenge when your boss knows your business better than you. So friends and colleagues, looking back on MDGs, when we deal with, friendly sister sectors like water and sanitation, education, MDGs did not face the kind of hostility, well-heeled and also underhanded resistance going forward. So that's why the complexity in NCD challenges is beyond our imagination. And one very prominent minister said yesterday, the success or otherwise of UHC depends on how well we manage NCDs. NCDs will destroy, the system you put in place. So if you do both well, you get, synergy and double benefit, but otherwise, it's a double whammy. So, the interrelationship there is extremely important. Again, we need to challenge, what do we mean by socio-economic progress? In the old days, when a country has made improvement in socio-economic progress, people become healthier, people get educated, right? Diseases fell. The HDB flats that the government introduced, when they move people from kampong, meaning villages, into HDB flat, you can see parasitic disease decline. Prof. Lee Hin Ping, you told me that when I was studying here. I still remember the anecdote, the story you told me. So good housing, good waters and sanitation, all these contribute to health. But now going forward, when you're dealing with NCDs, you're dealing with big guys, powerful industry. So how can governments find the right balance between promoting foreign direct investment, which is good for the country, but at the same time also managing their not so good effects? And I want to share with you another statistics, since you use diabetes as an example. In 2013, Chinese researchers published the results of a large national survey designed to measure the prevalence of diabetes in China. The authors estimated that China now has 114 million adults living with diabetes. 114 million, although China has 1.3 billion people, okay? This represents about 12% of the Chinese adult population. And the authors of this study was looking for an answer. So he came to the conclusion that modernization and rising income were propelling lifestyle diseases, including a shift from the traditional healthy diet to westernized diet. And the media coverage of these alarming findings prompted a Chinese newspaper to run a cartoon And the cartoon was showing a patient talking to his doctor. The patient asked the doctor, "Is there a cure for diabetes?" The doctor's answer is, "Yes, poverty." So friends and colleagues, sometimes, economic progress is important, human development is important, but those conditions also open wide the door for other influences that will bring a different set of challenges, like the NCDs. Now, let me also share with you our thoughts on the Ebola outbreak in West Africa. The Ebola outbreak clearly revealed that the world is ill-prepared to respond to any epidemic that is both severe and sustained. The world went to battle against this deadly and dreaded disease with no war chest, no army of reinforcements in reserve, and no weapons, meaning controlled tools. Ebola has been around for 40 years. How come the R&D investment of pharmaceutical company did not come up with a solution? It's only the US government. We need to thank the US and also the Canadian government for their investment so that we have two potential vaccine candidates for us to fast forward the clinical trials. Now, why do they invest in those R&D? The reason they invest is because they are afraid that this agent would be used for bioterrorism, not health. But never mind, we take their benefits. Another big challenge, the climate. The climate is certainly changing. The evidence is very strong. And many vector-borne diseases are highly sensitive to climate variables. Dengue is one good example and is affecting this part of the world in a big way. Malaria is another one. Now, for climate change, unfortunately, health have very little say in terms of the policy, as I explained earlier. And I was very happy that the French government, who will be hosting the next conference of the parties to negotiate a new treaty in Paris end of this year, and they understand the co-benefits of climate and health. And WHO has been approached to work very closely with many governments to illustrate what health can do to mitigate or in terms of adaptation to deal with the onslaught of climate change. So friends and colleagues, we should not be too pessimistic. Based on the public health track record, we should be optimistic because we are used to fighting in the trenches, aren't we? Time and time again, with optimism, ingenuity, evidence, and ethics on our side, the negative forces have always been confronted and overcome. For HIV/AIDS, as I said, let me use that as an example. A combination of civil society pressure on pharmaceutical industry, a solid regulatory system for approving generic products, and the assurance by national governments and donors of a significant and reliable market reduced the price of antiretroviral medicine by more than 100-fold since the start of this century. In the early days, only a few rich countries can afford that medicine. But now the price of antiretroviral medicine, the per year treatment for an individual is about $200 per person per year, compared to about 100,000 per person per year. So this is the kind of changes that public health, through your hard work, through your evidence, that WHO, working with governments of the world, can make good changes. Another example, why is Africa always the last group of countries to benefit from innovation? Because of market failure. No matter how affordable these products are, they cannot afford it. I gave you an example of our neglected tropical diseases. That's why WHO have to receive donations so that we send the medicines. They only cost, some of these medicines only cost cents. People in the bottom 1 billion poorest of the poor cannot even afford that, let alone other things. Again, innovation. Through WHO's facilitation, we work with PATH, we work with a host of countries in Africa, the US, the Netherlands, Canada, and India. We produced the first ever meningitis vaccine to benefit more than 20 countries in sub-Saharan Africa, the famous meningitis belt. Every year, parents just dread their children getting infected by meningitis. For those of us who understand the negative impact of meningitis on the cognitive capacity of children, they leave children disabled. This new vaccine was launched for the first time in Africa. So in other words, network, collaboration, partnership, science, and innovation is still the way going forward for post-2015, when the world has to deal with 17 goals. Many of them are very important for the health and well-being and for the education of people, so that we have educated, healthy human capital to sustain economic growth. Without growth, you cannot begin to talk about poverty elimination or eradication. Without growth and jobs, you cannot begin to talk about inclusiveness. No one should be left behind because they are women, because they are marginalized groups, or because they are poor. So, friends, colleagues, especially young public health champions, take the flag to move the world. Thank you.
Thank you, Dr. Margaret Chan, for that very insightful talk. Brilliant as ever. We'd like to invite Dr. Chan to now take a seat and for Prof. John Wong to join him.
Well, thank you very much, Dr. Chan, for, again, your candid comments to put things, the whole world into perspective in 30 minutes. So we're going to spend the next 45 minutes or so in a dialogue session, and joining me on stage are three of our colleagues. So we've chosen young faculty, so let me introduce the first one, Dr. Winston Chin. Is Winston around? Great, Winston, come on up. Okay. So Winston he's currently one of our senior residents in our residency program in preventive medicine. He was previously Assistant Director in the Aging Planning Office of the Ministry of Health and has recently completed his Masters of Public Health. Winston, thanks for joining us. Our second colleague is Dr. Joanne Yoong. Joanne is one of our assistant professors with great interest in behavioral economics and program evaluation. We're going to split the women up here, so yes, that's right. It's very dangerous when you have women sitting there. And Joanne, besides being one of our faculty, also holds appointments at the University of Southern California, the London School of Hygiene and Tropical Medicine, and also is adjunct staff at the RAND Corporation. And our third colleague joining us here is Associate Professor Vernon Lee. Many of you know Vernon from our infectious disease outbreaks. He's head of the Singapore Armed Forces Biodefence Center and a preventive medicine physician. Has also worked, he used to, and I think he probably still does, do work in WHO. So I think on secondment, well, I think we're all, actually, Dr. Chan, I think we're all seconded to WHO. Because, no, but truth be told, I think that in this challenging world, there is only one body in the world that can convene all the governments to talk about health, and that is the WHO. So, I think that the WHO has gone through challenging times, but it's also our best hope for the future. You've seen the challenges that we face, and I think that this is a chance, because Asia is home to nearly half of the world's burden of chronic non-communicable diseases. The figures are stunning. You saw Professor Chaki Singh's data of what's happening in Singapore. In Singapore, the incidence of people being overweight in organizations easily hitting 30–40%. Cancer is the leading cause of death. So I think that we face a huge burden of chronic non-communicable diseases in Singapore and the region. We're equally challenged by the problems of infectious disease, both emerging infectious diseases as well as recurrence of diseases that we thought were long gone. I mean, when I was in medical school here, when they were talking about chikungunya, I said, forget it. I don't have to worry about that. So chikungunya was one of those things I did not study because I figured it wasn't going to appear in the exams, and it didn't appear in the exams. But you can see what globalization has done. So Asia is faced with the twin challenges of both a tremendous, rapidly increasing burden of chronic non-communicable diseases, as well as infectious diseases. And that's probably, one, I mentioned at the start that Singapore has been a good friend of Dr. Chan and vice versa. We both went through SARS together. And I think that this was a crucible that taught us. So maybe I can ask my colleagues whether, what are the issues that the current generation are grappling with? Because like Dr. Chan, we're both on the other side of 40. Okay, so Winston, why don't you lead off? What are some of the things that keep you up awake at night?
Hi. Actually, as an Asian, I'm usually trained to defer to my elders, but in this case, since I'm probably the youngest one here, thanks very much, Dean, for this chance to be in this very distinguished panel. I feel kind of overawed with such distinguished colleagues. I think I received my MPH from the Swee School. I think I can be glad to say that I was the first batch of graduating students from the newly minted school, so of that I'm proud. And I think one of the things that I took away from the school is precisely what Dr. Chan mentioned earlier, that in this age, I think a lot of the determinants of health and disease, in fact, are non-health in nature, are social, economic. One of the first things I learned, in the school is that obesity itself is not so much an issue of health awareness. It's actually an economic issue. It's driven by economic forces that are beyond the individual's control, like what Dr. Chan alluded to earlier. And in some ways, I feel that it's often a modern paradox that on one hand, we are trying to push for economic growth in many countries. And on the other hand, we are also conscious of the challenges that economic growth brings to health, right, in terms of diabetes and chronic disease. And sometimes as a young public health practitioner, I feel awed by the challenge that we seem to be facing. And so I often wonder whether, in the face of these challenges, that public health perhaps needs to modify its approaches a bit to become more savvy in this world where non-health factors play such a big part. And I wonder whether, for example, in the era of aggressive marketing by companies and big businesses, whether public health practitioners, we ourselves, can become more savvy in marketing health as something as opposed to unhealthy lifestyles. And I'd be really happy to hear what the rest of the panel or Dr. Chan has to say about this as well.
So maybe I can, Dr. Chan, can I just get, what is WHO's plan to say harness social media in crowdsourcing or some positive galvanizing force to really tap on people's knowledge and changing behavior?
Thank you, John. Thank you for that question. You talk about the importance of marketing, and that is linked to the importance of information either through social media or whatever digital means. The challenge, for individual and for countries and for WHO, let me take it in that order. For individual, you need to be able to have the knowledge, the education to discriminate facts from hearsay. Let me use nutritional advice. Today, you open the newspaper, they say that coffee is not good for you. Tomorrow, they say that it is excellent. The same thing goes for butter or margarine, and they argue. So on an individual basis, how do you discriminate that? Now, from the government, actually, it's not enviable to be working for the governments nowadays. You are getting pressure from both ends, for your members of parliament, and then also from your general public, and so on and so forth. Again, when they are confused, they come to the government, hoping that the government would be able to give them the answer. And oftentimes they can't, because, as I said, depending on the power of evidence and the sample size, Chochuan, you talk about that. No? And again, what is the strength of evidence? How do you take evidence and turn them into guidelines? And this is the role of WHO. I just finished the executive board in January. There was one very interesting debate about the sugar guideline that was promulgated by WHO. And of course, we make one recommendation on the daily consumption, should not be more than 10 grams. And this is about, not already the sugar included in fruits or in processed food. The evidence is very solid in terms of 10 grams. And that yet, again, Japan, thanks for their dentists, they did a study and indicated that, even reducing it further to 5 grams would be beneficial for dental caries. Now, in terms of evidence, the strength is not as good as 10 grams. But WHO, as a normative organization, we cannot hide some evidence, no matter how weak or how strong. So what we do is we segment the level of evidence to say that the 10-gram recommendation is based on very strong evidence. But the 5-gram, this is a study that was done and illustrate the relationship of poor dental caries with sugar intake, but recommend more research needs to be done. Then you may say that it's very confusing, isn't it? Which are we supposed to take? Now, again, go back to the individual level. We are here to give advice, but we don't want to become the nanny state. People prefer to have choice. So you empower them with information, you give them the environment, as you do in Singapore, to make healthy choices. So we are moving into a very exciting world. So again, goes back to education. If you are educated, you understand what your choices are, they are trade-offs. Professor Kishore told us he put 3 spoons of sugar in his coffee. But in the morning, he did 8-kilometer jogging. So that's okay. So in life, it's all about balance.
Okay, Joanne, you're the one always tossing difficult questions to me as a member of the, of the administration. So how, from your viewpoint, I guess the big challenge has always been how to demonstrate effectiveness. Of platforms and of strategies. What would you think would be some of the issues that you would want Dr. Chan to comment on?
Thank you, Winston. Actually, I was going to say when Winston said that as a public health professional, he's trained to be very deferential to his elders, I was going to say, as an economist, they train us in absolutely the opposite direction. So I'm very happy to be here, and actually I'm very happy to hear so much of the discussion today to be revolving around economics, and actually the topic of behavioral economics. I think it's very exciting for us to hear that the WHO is being very proactive in looking at the role of behavior. We know, for example, that this year the World Bank has dedicated the 2015 World Development Report to an understanding of how behavior, mind, and choice affect economic development in many areas, including health in less developed countries. So this is an area that we really see all international organizations starting to focus on. I think when we talk about proving effectiveness, I really want to actually go back to what Dr. Chan said, which is that when we want to think about proving effectiveness, we have to think about it on these three levels: to individuals, and to industry, and also to policymakers. And at all these three levels, we have very different challenges. We want to prove effectiveness to individuals. We have a real problem, going back to this topic of the fact that in the world that we live in today, anecdote has more power than science. If we go to social media today, any one of us who goes to our Facebook feeds, as happens to me every morning, will see good friends of ours, educated friends of ours, posting things that are completely wrong. Yeah? About how to prevent cancer, drinking hot water in the morning, and what this does for you. And these things we can see get liked and spread and disseminated. The fact is that what we have to think about are new strategies to make choices that are effective, so from a scientific point of view, also appear effective to individuals. And this area of choice architecture and behavioral design is something that we now, I think, as public health professionals have to take very seriously. So as Winston said, I think it seems as if we should try to get into the area of public relations, and we used to say it's just marketing. And now we know that markets are very powerful. We actually don't have the choice to say it's just marketing. So I'd like actually maybe perhaps to also reflect on the fact that at the governmental level or the industry level, we have no problem showing value. For them, they want to know what the consumer wants, and they're willing, as Dr. Chan said, to invest significant sum of money in finding out what makes you take the next bite of the Dorito. And they are incentivized in that direction. But for policymakers, I think we still struggle. The area of development and health economics in Singapore, I'm very happy to say, is growing very rapidly. But collecting cost data, doing rigorous analysis beyond effectiveness trials requires actually that we have a public health professional environment that embraces not just clinicians, but people who are concerned about value for money. And it's no longer the case, I think, that we want to prioritize clinical effectiveness over understanding what it is that's best for our society as a whole. Making those arguments is very difficult and very challenging because I think what Dr. Chan alluded to earlier is the fact that we find it very hard to talk across disciplines. Again, bringing this back to Professor Chiaki Singh's point of view. In this world nowadays, we have had clinicians work in silos and economists work in silos. We find that when we have conversations about the WHO that involve talking about global economics and trade, that we have large segments of the audience that at one time are very concerned that they don't understand what has just gone on. So I would actually like to turn this back to you to ask you, what is the role of the WHO in facilitating these conversations between different groups of academics, between academics and actually policymakers, between industry and precisely, again, academics, policymakers, and individuals? How do we want to take these conversations forward, and how should we be actually educating our future leaders to make this happen?
Thank you. Thank you, Joanne. You asked a $64 million question, but extremely important question. She was asking the question, what can WHO do to convene all stakeholders together to talk about what are the solutions to deal with the health challenges? Now, let me explain what WHO is. WHO is a member states organization. You have to be a state in order to be a member of WHO. We have 194 members, meaning countries. And the international civil servant, and I am one of them, work for these governments. Governments of the world come to WHO for meeting, and they debate on a range of important issues. And I can see the difference even in the delegation coming from government. Some delegations have moved fast forward involving multi-stakeholders. The delegation would consist of government officials, definitely. They would also include members of the civil society, academics, And in some countries, industry is disguised as a government delegation. It's no secret. Because other stakeholders who are not state party cannot come to WHO for meeting. Now, some people say that maybe we should change that. So my advice to you is don't waste your political capital on that. Countries of the world would not agree to be at equal footing with civil society, with industry, with others. But we need to be very creative to think of ways that we can convene people to have dialogue. Now, let me use an example on NCD. Leaders of the world in New York in 2011 gave a political declaration on the importance of NCD and tasked WHO to do a range of things. Among them is to listen to all the stakeholders. Recognizing the sensitivity of member state-only platform, I will convene countries of the world to discuss and get their permission for me to organize hearings. We call it hearings. We listen to the civil society, we listen to the scientists, academic, we also listen to the industry and find public health solutions. So this is the way, a creative way, in a very 65-year-old organization, pretty old, isn't it? So I don't want to use the term archaic, but it is archaic. And I cannot change the constitution, and neither do countries want to do that. So countries, in a way, is falling behind reality again. Go back to what I said this morning. You have to be grounded in reality. Tell me how many of you, not only in Singapore, which country in the world where the government does everything? Provide healthcare, provide education, provide water and sanitation, produce food that you eat, produce, iPhone that you are working with, and the TV and the car you drive. Which country in the world does that?
Apple.
I'm not telling you the answer. You know the answer. And you got it. So, in other words, countries are actually moving fast forward based on the reality on their country and work with multi-stakeholders. And yet, countries at the global level in Geneva in WHO, they say that, Dr. Chan, you cannot work with the industry because of conflict of interest. So this was the question I raised even at the Universal Health Care, a meeting 2 days ago. Countries of the world must tell me, why are you working at the national level with the industry? I was struck with your promotion board. Oh, your CEO was smart. He told me he's working with McDonald's. I said, if I work with McDonald's in Geneva, I'm going to lose my job. That's okay. But, this is the challenge for us, again, the disconnect, with the reality of the world.
But Dr. Chan, I think that, yes, I think the challenges we have because we are still sovereign, we live in a world of sovereign states, but yet global issues. But I think that WHO, you've done incredible things. The issues on tobacco control, the issues on HIV drug pricing. I mean, these happened within our lifetimes. I mean, when you and I were growing up, smoking was the norm.
That's right.
Now in many countries, smoking is not the norm. And so what are the lessons learned that WHO took for, say, HIV drug pricing, which clearly was against certain companies' issues, as well as tobacco control, and get it to where it is today?
John, you asked an excellent question. The power of public health. Let me go back to that. You give me the evidence through the scientists. There is only one thing WHO can stand on, which is strong evidence of what works. Based on that, I need to convene countries of the world to come together. It is about flexibility. It is about give and take. We need very strong and robust civil society. Keep pushing the limits, pushing the envelope. And industry is actually quite smart now. They are beginning to learn from the examples of HIV and others. Instead of talking about profit, 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 they talk about profit and share values. What values? The values of countries that you are investing in. I don't think countries of the world should allow industry, no matter how powerful they are, to trample governments, because you, the voters in the government, need to speak up as well. You empower your government to make the right decision. As I said, why should your Minister of Health sign up to FCTC and then your Minister of Trade do the opposite? So, where's the government? Well, clearly, one of those government, I'm not going to say the name, there is policy incoherence. The head of the state need to be the person. So that's exactly what I said to your PM. Minister of Health has no power in certain things. You as the PM, who can bring what I call whole of government approach, multi-sectoral coherence in order to promote NCD and universal health coverage. So the power of the state would still be very influential. No country in the world, no matter how weak, how fragile, would allow anybody else, including the UN, to take over. No. So that's a reality we must face. So be smart and work with governments and leverage on governments. But use the science that you produce and then use civil society to move a social movement to change things. I am quite optimistic, with the big group of young people that I'm seeing today in Singapore and in many other countries. Be creative. Be yourself. Don't listen to your elders all the time.
I think that Kee Seng told me some time ago that when Dr. Margaret Chan was a student here, she was still very much the ringleader and still is. So before I open this to the floor, and including to our colleagues who are watching this, if you, I'd like to throw this open to the floor after I get comments from Vernon. But please think of your questions, and for those of you who are watching this live, if you want to send in questions, if you can get it on a piece of paper and pass it to one of the staff here, they can, I can read it out. But Vernon, as I mentioned at the start, we're dealing with the twin challenges of NCDs as well as infectious disease. You lead many of our efforts in infectious disease.
Sure. I think a lot of the themes that Dr. Chan and the panelists have brought up are pretty much the same whether you're looking at NCDs or infectious diseases. If you think about the threat of NCDs and the drivers for NCDs being, a lot of these globalized trends, marketing and so on, these do not respect borders. And if you look at infectious diseases, whether it's SARS, Ebola, and so on, these do not respect borders either. So it's certainly imperative that we work together. And it's intuitive that, we have to bring together different sectors. We have to work in a whole of government, a whole of society approach, and we have said this yet and yet again. I think, just to give one example about the current Ebola crisis, which has seen, WHO putting a lot of effort to coordinate this massive global response. But in fact, if we take ourselves one step back and look at, for example, the International Health Regulations of 2005, which was formed after SARS, and the IHR had set targets for countries to develop their own capacities and capabilities to deal with these diseases. And we know that a lot of these countries require global support to help them to develop these capacities, and yet we are still falling short of those targets. So it's not just in NCDs or infectious diseases. How can we actually bring our collective resources across countries to bear? Because we know it's not someone else's problem. Someone else's problem will quickly become our problem very soon. How can we, as a sort of globalized entity, bring together all of our collective resources to help those in need, and that, in a way, helps ourselves? And this is something that's very tricky to answer, because every time you see all this rhetoric about we should help our neighbor in need, we should do this and do that, but when it comes to the crunch about asking countries to put their resources. And we're not talking about money. We're talking about all kinds of resources, whether it's thought leadership, whether it's resources in kind and so on, to assist others. It always falls short somehow. So maybe this, I'll put it back to Dr. Chan. How can WHO and perhaps other institutions and countries come together to make our world a better place or a safer place in the future, taking into account all of the lessons that we learned in the past about trying to get people to come together in this whole of society or whole of the earth approach?
Even when it's not affecting their own backyard, but it's somebody else's backyard.
Yeah, because that will quickly become your own problem, your own
exactly.
backyard if you don't deal with it. So, it's a matter of when.
Yep.
Yeah.
I think, Vernon, you'd raise a very important point that we must address collectively as a global community. You make reference to the International Health Regulation 2005, which was amended after SARS. And Singapore has suffered from SARS as well, along with Hong Kong. At that time, I was working in Hong Kong. The International Health Regulation, like the Framework Convention on Tobacco Control, is another international treaty, promulgated by WHO. All countries, 196 states, a couple of them were not members of WHO, were signatory. So when you sign up to a convention, you must fulfill your obligation. Exactly as you put it. There are requirements to the state to put in place what we call core capacity to detect disease, to report disease, and to respond. So surveillance, laboratory capacity, do you have that? Ebola in West Africa show us the lesson. In countries that are very weak, with virtually non-existing health system, these countries are talking about having 1 to 2 doctors per 100,000 population. These are countries that do not have clinics. The hospital they don't have isolation ward. What they have is flood, electricity, power out. So this is the kind of situation. And Ebola was missed. The diagnosis was missed for 3 months before it was diagnosed. At first, it was diagnosed as cholera. So when you have countries that have virtually very weak capacity, you may say that, oh, it's not in my courtyard. But again, for self-enlightened interests, you must help these countries to build their capacity. If I tell you, WHO has 194 member states, only 64 of them self-profess, self-assess, they have the IHR capacity. What does that figure tell you? The weakest link for diseases that can cross your national boundary are in these countries that have no capacity. And we have seen this. So Ebola moved from these 3 countries. Epidemiologically, we look at it as a one block because the cross-border between these 3 countries, and that's where 70% of the initial cases, are originating from. These 3 countries, at least Liberia go to Nigeria, Guinea went to Senegal, and then, of course, Liberia go to US, and then that's history. Ebola has spread to 7 to 9 countries now, I cannot remember, having been in Singapore for 2 days with your Hai Lang Gai Fan. 3 continents. And these are countries like USA, UK, and Spain. They can manage huge capacity and in terms of human and everything to manage on their own. Senegal, Nigeria, DRC were successful examples, and Mali as well. They were successful with some support from MSF, CDC, USA, and WHO, and other partners. Just give them a little bit of push, and they can manage. But in these 3 countries, where they have virtually nothing. So going back, the world will never de-link when it comes to communicable diseases. Communicable diseases will come to your doorstep. So for self-enlightened interests, the world must come together, and either through North-South, South-South collaboration, or triangulation, meaning using UN agency to support these countries to build the basic infrastructure and healthcare worker to be able to detect diseases and alert the whole world. As we are speaking, we have MERS-CoV virus in Middle East, okay? It has gone to Philippines now. We have H7N9 in China, and we have another new N again, H5N6 or whatever. I have to follow up on the latest news. So what does WHO do? WHO monitor the world's media to trawl outbreaks. We verify them on a regular basis. We call up countries and help countries and offer support so that we know when is the time we need to sound the alert to the rest of the world so that the countries are prepared. So in a highly connected world, I think it is in our own interest to make sure first have national capacity and have a good international response system, as in the case of Ebola. You may not be sending people to West Africa, but Singapore is contributing in other ways through UN, so the international response also need to improve in terms of coordination, can we work faster, and so on and so forth. Last but not the least, R&D in innovations. Why do we allow a disease that has been known to be severe and known for 40 years and not even having a medicine, a vaccine, and a diagnostic to help, control that? So in all these areas, WHO and working with many countries would be able to provide some offer and help to the countries. And on this, I would urge the Singapore government. Yes, you are small in terms of land mass and population. Use your influence. Your influence is in your human asset. People, highly educated, very, sophisticated, be more active in the international scene. I'm going to talk to your leaders, okay?
Well, Dr. Chan, just to let you know, our head of infectious diseases, as well as our head of infection control, have been to West Africa twice to help with the Ebola crisis. So maybe I can ask the audience whether anyone would like to pose a question or comment, preferably a question to Dr. Chan and the panel. Okay, so while you're thinking, Joanne.
Yeah, actually, I do want to sort of beg your indulgence for one more question, but I will also say that it's not my question, because I'm also a teacher, and so I asked my class, SPH 3103, if you're watching, this is for you. SPH 3103, if they would have questions to direct to Dr. Chan, and SPH 3103, being very diligent, sent me 47 questions. Which we're going to go through all of them. One. Actually, I was going to say, we're going to go through all of them. No, but there's just one, and I think actually it follows directly from what you just said, which is that to be a little bit specific about what you ended up speaking about at the end, which is that, excuse me, I'm just demonstrating infectious diseases. For Singapore, how can Singapore actually demonstrate leadership in this area, and what are the challenges of doing so in this era? And more specifically, since this question came from one of my students, as a young person in Singapore who has not yet started their career, what should they be doing to take on this role? If you were again in this day and age able to do it all over again, what would you do to take on a role of a public health thought leader?
First, follow what Professor Keesing said this morning. Don't work in silos. Don't think in silos. Network, partnership, cross-thinking, cross-fertilization is the way forward, okay? If you have not made up your mind, don't worry. You don't need to rush. You need to find your true love before you invest your life. Why? Public health or either medicine is a lifelong commitment. If you are not prepared to invest time energy, and do good, if you want to make money, then you need to think about your choice. Public health is not an area where you're going to make money. Not a lot. You can have a decent life, but you're doing huge good for humanity. And I would encourage you to do that. You know, contribution can be done in multiple ways. I truly believe Singapore, because you're so well educated, you have security in this country, your government is prepared to invest in human capital, in R&D, as I said, innovation, either in thinking, in behavioral change, in social marketing, or in science, would always be the one that will make the biggest impact. You look at medicine. No innovation, you cannot leverage the power. Yes, you may have some contribution, but it's not huge. Think of penicillin. Think of the vaccines. Think of all these things that came through the medical research community. So be yourself, follow your dream. It's okay to even change course after a little while. I was a teacher. I never imagined I'd become a doctor. So I was a teacher to start with, and I changed course and became a doctor. I was educated in Canada, and it's only when I was educated in Singapore then I fell in love with public health. So thank you for giving me that opportunity.
Well, Dr. Chan, I would say you're still a teacher. In fact, you're probably the ultimate principal right now. Okay, we've got two questions actually from our colleagues who are watching this live, and I'll probably group them together. So one is, what is WHO's plan for smokeless tobacco? Specific question. And the second is a question about what's your advice and how can Singapore develop a regional approach? Perhaps, so what is the platform of, say, ASEAN in reducing burden of disease?
Singapore is well positioned in terms of its geographical location and also all your alumni. Just go and look up all the alumni that you have trained over the years. I graduated 30 years ago. Okay? Go and, look at that, the registry. And I bet you my bottom dollar, many of your alumni already move up to very senior position in many governments. Don't forget your friends. And this is the leverage and the power that you can bring to bear. Influence. Okay. Now on smokeless tobacco, this is a challenging area. And for your information, at the latest meeting, the COP6 Conference of the Party, the 6th meeting held in Moscow, they were debating on this issue. WHO's recommendation is very clear. More research needs to be done in the area to demonstrate whether or not regulatory measures and other measures would be as effective. So this is a holding answer, I'm sorry, but as I said, I'm advised by my experts, DG, don't give an answer on this one other than what we have told you.
So not only a principal, but very much a diplomat. Well, I'm getting signals that we need to start winding up. But perhaps I can ask Dr. Chan before before we leave. Personally, I think many of us here in the audience have always ascribed to the maxim, never waste a crisis. Because there's nothing like galvanizing opinion leaders and the public during a crisis. So, certainly the last 12 months have been challenging times. What would you say would be 3 things that you'd like us to take home following the latest crisis?
Thank you, John, for that important question. 2014 was truly a very challenging year. On a personal basis, I canceled all my leave and to manage Ebola. That is the work ethics we need to bring to the workforce. As a DG of WHO, given this event in West Africa, I need to spend every minute of my time on Ebola. But again, many people will say to me, Ebola is not the only important health issues of the world. So, how to find the right balance? Sometimes I spend 90% of my day on Ebola. Other time I need to talk about NCD, universal health care, tobacco control, and others. So being able to find the right balance is not easy, but you have to do it. Now, what lessons do we learn? I think it is fair to say the world, including WHO, was slow to see what was unfolding in front of our eyes. An old disease in a new context, which is totally different, meaning in countries that have little by way of health systems. No hospitals, no clinic, no health workforce, no road. And when you give them vehicles, you have to bring petrol as well. And so thank you to the generosity of all the countries, including Singapore and many others. But the big three is, of course, US, UK, EU, and also France. They helped these three countries to build hospital beds. Now we have 2,000 hospital beds. We have about more than 12,000 people working on the ground, mobilized from different parts of the world, including African Union and ECOWAS. These are important regional institutions who come to help. So what does it tell us? Country capacity in building health system is number one importance. The second lesson is the international response, UN agency, other partners, the coordination has to improve and better prepare for the next big pandemic. And the third point is what I'm saying, investment in R&D to come up with good medicines, vaccines for high-impact diseases. And of course, Ebola is one of them. And we should not forget about the importance of influenza. If it is caused by a severe virus like H5N1, the mortality is very high. So we must keep our eyes on different balls, but find the right balance to do all these things. Now, the World Health Organization member states met on the 25th of January this year and have a special session to look at what are some of the lessons that WHO can learn, the international community can learn, as well as countries. So going forward, there will be a series of assessment, evaluation to learn lessons and better prepare for the next pandemic. I was reminded by generals, real generals in military, don't look at the last war. Always look ahead and plan for the next war. The next war is the biggest of all monsters. Influenza pandemic caused by a very severe virus. Can you imagine which country will release their health workforce to help other countries? None. They need to keep their people in their own country to defend the health of their people. So in that kind of a scenario, what is the role of UN and other actors in the world? So what is the role of government, etc.? So for me, that's why influenza is important. We need to work very hard to find the right vaccine. Unlike this year, the influenza vaccine was not a good match. But this is a challenge between humanity and the microbial world. Influenza virus is a very smart virus because it changes so much. Every year, WHO organizes 2 meetings to determine the composition of influenza vaccines. The decision was made in February, and then the virus drifted, meaning change, in March. So smart, right? So how can we catch up? And in fact, Bill Gates, everybody knows Bill Gates, asked me one very smart question. He said, Margaret, how come the scientists of the world cannot find one vaccine that will deal with all influenza virus? Excellent question. But the science is not there yet. We don't have the platform to be able to do that. But keep up with your important work. You never know. You may be able to do it in 5 years' time. But humanity continues forever. Thank you.
Well, much as I hate to, I have to call this panel to a conclusion. But Dr. Chan, personally, I thank you, and we all thank you for taking your time off to spend this, last few days with us. The whole world looks to you, and I think I'm honestly proud to say that we're extremely proud of you as an alumnus and as a person from this part of the world. I think that you have shown what a woman and an Asian can do in helping shape global policy. So on behalf of all of us at NUHS, Singapore, and the world, thank you very much.
Thank you, Dr. Chan, Professor Wong, Associate Professor Lee, Assistant Professor Yoong, and Dr. Chin for their insights to the challenge of public health. Dr. Chan, may we invite you to stay on stage for a little while longer?
Now, I know after such a thought-provoking discussion, most of us must be hungry. But please bear with us for a few more moments, because our Dean, Professor Chia Kee Sing, would like to present a token of appreciation. Yeah, our Dean, Professor Chia Kee Sing, would like to present a token of appreciation to his Daikate, Dr. Margaret Wong Chan. And I'm told that, unfortunately, it's not char siu bao or hoi nam gai fan. So, ladies and gentlemen, what you have on the screen at the moment So this is a photo of Professor Chia's MPH cohort. Can you spot him? And some of you may have already noticed that he was actually classmates with Dr. Chan in his 1985 honeymoon. Okay, we'll give you the answer. Over here. Wait, and let us show you Professor Chia in his 1980s.
I was asked once, did you ever have an afro? I said, yes, I did, but I forgot which period. So thank you for reminding me.
Ladies and gentlemen, we have come to the end of today's events. I hope that you have enjoyed yourself and gained many insights from the dialogue. We have prepared food for you. Lunch will be served at level 2 and at level 3. Please feel free to stay on, eat, walk around, mingle, network around, and enjoy the rest of the day.
Thank you.
Goodbye.